Hello, everyone, and a warm welcome to another episode of the Talkroom series of podcasts. I'm Wendy, and today we're diving into an incredibly important topic, mental health and well-being, specifically focusing on premenstrual dysphoric disorder, or PMDD for short. Our goal is to explore how you can be your best self, even when faced with the challenges of this condition, by leveraging the power of counselling and therapeutic support. So, for those of you who are joining us for the first time, I'd like to introduce my co-presenter, Ian. Ian is a senior accredited National Counselling and Psychotherapy Society member and also the founder of Hope Therapy and Counselling Services. Hope is a counselling organisation offering support throughout the UK for a wide range of presentations, including PMDD, which we're discussing today. So a warm welcome to you, Ian.
Thank you, Wendy. Thank you as always. And let me return the favour by introducing you. Wendy is a highly experienced CBT psychotherapist who's been involved in the field of mental health and well-being for well over 30 years now. We're both extremely passionate about helping people navigate their mental health journeys, and today's discussion is a really important part of that.
Thank you very much, Ian. So, as we've said already, today's episode is all about PMDD, a topic that unfortunately doesn't get the attention it deserves. So let's start with the basics, Ian. What exactly is PMDD and when might someone consider seeking support for it?
Really good question. So thank you, Wendy. So PMDD, or Premenstrual Dysphoric Disorder, is often described as an extreme form of PMS, but it's much more than that. Whilst PMS can involve symptoms like mood swings or irritability and physical discomfort, PMDD is characterized by severe emotional and physical symptoms that can really significantly disrupt daily life. Symptoms can typically occur in what's referred to as the luteal phase of the menstrual cycle, and that's the time between ovulation and the start of menstruation. For those living with PMDD, that phase can bring a really intense level of mood disturbances. It can bring things such as feeling a very deep sadness or an anxiety and irritability, even a sense of hopelessness for some people. And on top of that, physical symptoms like fatigue or sleep issues, joint or muscle pain, very severe bloating can also be a cause of real distress for some. For many, the symptoms can be so debilitating that they interfere with work, they interfere with relationships and overall quality of life. So really quite significant. And as for your question, when's the right time to reach out for support, what we would say is that if symptoms are consistently impacting your ability to function or causing significant distress, we'd really be suggesting that you reach out for help. And that might include experiencing worsening depression or anxiety or anger before your period, struggling with daily tasks, or feeling that you're just losing control of emotions during that period of time. And support may possibly start with a visit to your GP, and that can be really helpful just in terms of ruling out other conditions, and might for some people possibly lead to a diagnosis if that's appropriate. From there, treatment options might include things like hormonal therapies or antidepressants, particularly SSRIs, which for some people can be really quite effective in terms of managing the mood-related symptoms of PMDD. there's also counselling and therapeutic support that can be offered as well, and that's where organisations like Hope and others, yourself, come in, providing additional tools to manage the emotional and psychological aspects of the condition.
Okay, thank you, Ian. That's a very comprehensive explanation. So my next question, I'm wondering what sort of impacts PMDD maybe can have on your wider life, say work, partners, or friends even. Can you say a little bit more about that?
Yeah, certainly, Wendy. So for some people, untreated and unsupported PMDD can significantly impact somebody's ability to function at work. And I really stress that phrase, untreated and unsupported PMDD. Nowadays, there really are things that can be done to support people in a variety of ways. But the severe mood swings, the depression, the anxiety, the fatigue that some experience can make it very difficult to concentrate, difficult to meet deadlines, or maintain the same level of productivity throughout the month. So we work with clients who say that there can be days when the physical symptoms like headaches and joint pains or extreme bloating are so intense that they even struggle with getting out of bed on those days. It can just be a really monumental task for them. So for some, untreated and unsupported PMDD can lead to increased absenteeism when they need to take time off work during that luteal phase of the cycle when symptoms are at their worst. Others may find that even if they make it into work, they really struggle with staying focused. They're maybe more irritable, which can just lead to misunderstandings and conflicts with colleagues. So it really can be problematic for some people where it's left unsupported. And the emphasis really in that is to reach out to get the support that's needed. Yeah, that's a really important part of it.
Okay, thank you, Ian. Yeah, so I mean, it does sound really challenging, especially in work environments that might not be very understanding or accommodating. So I'm wondering whether you've got any advice you would give to someone who's trying to navigate these kind of challenges at work.
Yeah, and what we would always say is communication is key. If you feel comfortable, it can be helpful to have a conversation with your employer or the HR department about what you're going through, what you're experiencing. Some workplaces can be absolutely great. They might well be willing to offer flexible working hours or the option to work from home on particular days if they're particularly challenging. It's also important to establish healthy boundaries at work as well. So not being afraid to say no to additional tasks if you know you're approaching that very difficult phase of your cycle. And another strategy is to try to plan your work around the cycle. So if you know that you have a window where the symptoms are less intense, maybe trying to schedule more demanding tasks during that period. And on the flip side, during that luteal phase where symptoms can be at that peak, maybe trying to just lighten things a little bit to the extent that that's possible.
Okay. Yeah, thank you so much, Ian. I mean, they're really great tips, and I can see them being very relevant to people who are suffering from this condition. I'm just wondering, moving on to more the personal side of things, I'm just wondering how PMDD can affect relationships, whether that's with friends, family members, or romantic partners. I believe the emotional symptoms of PMDD can be really hard on relationships. Is that correct?
Yeah, no, that's absolutely right. So PMDD can strain relationships in varying different ways. So, for example, during a PMD episode, someone might experience heightened irritability or anger or sadness. which can just lead to conflicts, can lead to misunderstanding with loved ones. It's common for individuals with PMDD to feel guilty or frustrated after an episode, especially if they've said or done something they regret. And in romantic relationships, PMDD can affect intimacy and communication during those periods. So a partner might not fully understand what's happening, leading to feelings of confusion or even resentment at that point. It's not uncommon for couples to experience increased tension during that luteal phase of the cycle.
Mm. And I just can only imagine how really tough it must be, both for the individual with PMDD and their loved ones. And I wonder whether you can give us any more advice on how to manage these challenges within these relationships.
Yeah, and again, I think really open and honest communication is absolutely essential. It can be useful to educate our loved ones about PMDD so that they can just understand those symptoms. They can understand them as being part of a medical condition and not a reflection of your true feelings towards them. You can have a discussion during a time when you're feeling well to explain PMDD, how it affects you, what kind of support you might need during those particularly challenging times. Setting very clear boundaries can also be really important as well. So, for example, if you know that certain conversations or certain activities are just going to be too overwhelming during that particular period, it's okay to ask for some space. It's okay to postpone those things until you're feeling in a better place and more able to engage with those things. It's also really important to develop coping strategies together. So for couples, this might involve working with a counsellor or a therapist to improve communication skills, learning to manage conflict in a healthier, more constructive way, building stronger support systems that can withstand those types of challenges. So there are various things we can do.
Mm. Okay, thank you for that, Ian. Those suggestions are really valuable, so thank you. And I think it's important to acknowledge that PMDD can also impact friendships, family dynamics, not just romantic relationships. Sometimes friends or family members might not fully understand what's going on. And I'm assuming this might lead to feelings of isolation, for example.
Yeah, that's absolutely right. So friends, family might notice changes in your mood, may notice changes in behavior, but not really understand why those things are actually happening. So they might take it personally. So for example, if you cancel plans that you've made or notice that you're feeling that you're sounding or coming across as being very distant, it can just create a level of tension or lead to a level of misunderstanding. And again, educating those close to you about PMDD can go a really long way towards fostering more understanding and more patience within those close family and friendship relationships. Just letting them know that your symptoms are cyclical and that there will be times when you're more capable of engaging and participating in social events than at other points. It's also really important just to maintain those connections even during the difficult times as well, to the extent that that's possible. So a simple text, just to let someone know that you're thinking of them, even if you can't meet up, can just help maintain the relationship without putting too much pressure on yourself. So again, things that you can do.
Okay. Thank you, Ian. That's really insightful. And from what you're saying, it's really clear that a person with PMDD can have a really profound impact on somebody's life. So I'm just wondering how counselling or therapeutic support might make a difference for those living with PMDD.
Yeah, so lots of people reach out for counselling or therapeutic support and find it really, really incredibly helpful. So the first might be around that sort of broad heading of emotional support and validation. So one of the things that counselling can do is just provide a safe, a confidential space where people can express their thoughts, can express their feelings without fear of judgment. And that can be particularly important for somebody with PMDD who might feel isolated, might feel misunderstood. So just that being heard, that being validated by somebody that gets it can just alleviate the sense of loneliness, the sense of frustration that can so often accompany this particular condition. And then there might be work around symptom management. So there's a variety of different therapeutic approaches that can be adopted to help look at and support symptom management. One of those that people may have heard of previously is cognitive behavioral therapy, or CBT, which can be really effective in terms of identifying and challenging negative thought patterns that exacerbate emotional and physical symptoms. So just by learning to reframe those thoughts and adopt healthier behaviours, clients can reduce the severity of their symptoms and improve the quality of their life accordingly. Okay. There might be work around stress reduction. So given that stress can worsen PMDD symptoms, counselling can introduce stress management tools and techniques, and that might be things like mindfulness, meditation, progressive muscle relaxation, guided imagery. There's lots of different things, and those techniques not only reduce the stress itself, but can also start to enhance self-awareness as well. So helping people respond to their bodies in a more effective way. There might be behavioural strategies that people engage with. So counsellors can just work with clients to develop practical strategies for managing the unpredictable nature of PMDD. And that might involve creating routines that accommodate periods of low energy or mood, adjusting lifestyle factors like diet and exercise, finding ways to maintain productivity and control over day-to-day life. Looking at relationships. So as we talked about earlier, PMDD can place strain on relationships sometimes due to mood swings or emotional sensitivities. And counselling provides tools for improving communication, building stronger, more resilient relationships. So it helps clients just express their needs more clearly, set boundaries, and reducing misunderstanding and through that misunderstanding, conflicts. Then there might be a whole piece around education and awareness as well, just helping people to understand PMDD, the effect of PMDD, so that people don't start getting caught up in patterns of self-blame, but instead empowering clients to take proactive steps that might involve speaking to GPs where it's appropriate, or just making lifestyle changes that can contribute to symptom relief. Developing coping mechanisms. So some people find things like journaling really helpful to just process the emotions of what's come up. There might be physical activities that some people find really helpful. Exploring creative outlets like art or music therapy. For some people, those types of things have been really useful in terms of building longer term resilience. So lots and lots of things that can be done that can be really, really helpful.
Okay, that's very comprehensive, Ian. Thank you for that. And I know you mentioned CBT, cognitive behavior therapy. But are there any other particular therapeutic approaches, or can you perhaps expand more on the CBT that you find particularly effective in supporting people with PMDD?
Yeah, no, absolutely. And there are various different therapeutic approaches that can be tailored to meet the unique challenges of PMDD. So depending on how PMDD is expressing itself, people might find it helpful to use slightly different approaches. So if you mentioned CBT, so let's start by talking a little bit about that. So it's one of the most widely recognised and evidence-based approaches for treating PMDD. It's particularly effective in helping people just to manage the emotional aspects of things and validation aspect of coping with PMDD. So CBT can be useful in guiding clients to identify and challenge the negative thought patterns that contribute to the emotional distress that they're feeling. So, for instance, someone might frequently experience thoughts like, I'm a burden to everyone when I feel this way. CBT just helps to reframe those thoughts in a slightly more balanced, more balanced way and less distressing way. So we might reframe that into, I'm dealing with a challenging condition and it's okay to ask for support at times like this. So that not only provides emotional relief, but also fosters a stronger sense of self-compassion, a stronger sense of self-validation as well. And then if we move on to the symptom management side, CBT once again can play a really important role with that as well. So therapists often work with clients to track their symptoms, to identify triggers, and by recognizing those patterns, people can develop proactive strategies to manage their symptoms before they become completely overwhelming. So, for example, if a client notices that stress exacerbates their PMDD symptoms, they can learn various techniques, various CBT type techniques like cognitive restructuring to manage stress inducing thoughts and in turn reduce the severity of the symptoms that they're feeling. Another really powerful tool for managing PMDD is mindfulness. There are approaches like mindfulness-based stress reduction, mindfulness-based cognitive therapy, mindfulness-based self-compassion, which can be really helpful. So those approaches can be really effective in addressing the stress aspects that are associated with PMDD. So if we take MBSR, the mindfulness-based stress reduction program, for example, it incorporates mindfulness meditations and certain aspects of yoga, just encouraging individuals to stay present and aware of their thoughts, their bodily sensations without judgment. And that practice can be just really useful during that luteal phase when PMD symptoms are at their peak. So by cultivating mindfulness, clients can just help reduce the stress levels, gaining a better understanding of their emotional state and respond to their symptoms with a greater level of calm and greater level of resilience. We might look at something like dialectical behavioural therapy, or DBT. DBT has proven to be beneficial for clients that struggle with PMDD, especially in the context of behavioural strategies and improving interpersonal relationships. So DBT combines cognitive behavioural techniques with mindfulness practices, focusing on mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness. for PMDD sufferers, DBT can help to manage really quite intense emotions and develop strategies to navigate the mood swings that can often strain the relationship. And then through that DBT, clients can learn how to communicate more effectively their needs, set healthy boundaries, and then develop more constructive ways of interacting with others during those really challenging times. Psychoeducation can be really important for PMDD sufferers. So psychoeducation just involves providing clients with comprehensive information about the condition, its causes, its symptoms, the treatment options. That sort of educational component is often integrated into various other therapeutic approaches. Might well be included in CBT, might well be included in DBT. So by better understanding the physiological and the psychological underpinnings of PMDD, clients can then just start to feel more empowered and less overwhelmed by the symptoms. And then we might look at something like ACT, which is acceptance and commitment therapy. And ACT is an approach that emphasizes acceptance of difficult situations and emotions and commitment to personal values. So this particular type of therapy can be really supportive in terms of just helping developing coping mechanisms for the emotional and the physical challenges of PMDD. So ACT encourages people to embrace the emotional experience rather than pushing away and trying to ignore it. So for instance, a client might use ACT to accept feelings of irritability or sadness without letting those emotions dictate their actions. So instead they can commit to engaging in activities aligned with their values, such as self-care or connecting with loved ones, even when they're feeling low. So a very long answer, but in summary, there's several different therapeutic approaches that can be tailored to support the varying different challenges of PMDD: cognitive behavioural therapy, mindfulness-based stress reduction, dialectical behavioural therapy, psychoeducation, and ACT. All of them can be supportive of PMDD.
Okay, thank you, Ian. That, again, very comprehensive in your answer. So I'm just imagining, though, that some of these things discussed in counselling, that they can, for PMDD, be very difficult to talk about.
Yeah, and that's absolutely true, Wendy. So counselling, especially for something as personal as PMDD, can involve discussing quite challenging topics. But it's important to remember that counselling is a process that moves at the pace of the client. So counsellors train to create a safe, a supportive environment where you can explore your thoughts and your emotions without feeling rushed, without feeling overwhelmed, always at a pace that's right for the client. So there's never a sense of being rushed in these things. And the goal, really at its heart, is to build trust and ensure that you feel in control of your healing journey. And counselling is just a non-judgmental space where you can express whatever you're experiencing in that moment, whether it's intense emotions, whether it's difficult thoughts, difficult challenges, and to do that without fear of being criticised by your counsellor or your therapist. So your counsellor is there to listen. They're there to try as best they can to understand your experience without judgment and to support you, and through that to help you to navigate the conversations in a way that feels manageable and productive to you. So over time, that leads to just a deeper understanding of yourself, your experiences, all of which is a really, really crucial part of being able to manage this condition that we call PMDD.
Okay, thank you for that, Ian. Thank you. Very lots of knowledge in that answer. So thank you so much for that very comprehensive answer. So I'm just wondering, Ian, if someone has listened to this podcast and feels they might benefit from professional help, what should they do next?
Yeah. So if people are looking for support, organisations like Hope Therapy and Counselling services are absolutely there to help. We have a team of experienced counsellors who specialise in a wide variety of things, including PMDD. We have a website, www.hopeforminds.co.uk. That's www.hopeforminds.co.uk. There's lots and lots of free resources on the website. And we have lots and lots of detailed information about the services we provide, including PMDD. We also offer a free 15-minute consultation where people can just talk to us about their experiences, and we, in a very unpressurized sort of way, can just talk about some of the options that might be available and suitable for them. And you, Wendy, a highly experienced CBT therapist, worked with many clients over the years facing a whole variety of challenges. So I wonder if you could just share a little bit about how people could get in touch with you as well.
Yes, thank you, Ian. And I do see people with PMDD and any other issues around sort of fertility or female issues around HRT or menopause as well. They're quite very common issues that I come across. So you just need to contact me via my website, which is wendycastellino.com. So thank you, Ian, for sharing your insights today. And thank you so much for our listeners for tuning in. And just remember, if you're struggling with PMDD or any other mental health challenge, help is available, and taking that first step can make a real difference. So thank you, Ian, so much for your shared work today. Really appreciate it.
Thank you, Wendy, and thank you to all our listeners too. Bye-bye.